My speech is called Digital Transformation and the European Health Union Strategy. But let me tell you, because you are all thinkers, and today we are discussing about some thoughts, let me tell you that we are all confronting a lot of challenges. And the European Union project is confronted with a radical new context, colleagues. War in our continent and neighborhoods, fragmented global governance and geopolitical rivalry, climate emergency, cost of living crisis, pandemic experience, digital transformation with many challenges, a lot of misinformation spreading through social media, disturbing our democracies. It means that today, European Union, it needs to think about stronger European capacity to act, and it is evident on all of these fronts. And the current European Union treaties, of course, should be reassessed because the current treaties show their limits. The time has come to reassess them and identify some targeted changes. Recent developments are building up momentum for this, notably war, the enlargement as geopolitical imperative, the need to prepare it with EU internal reform, as well as aspirations expressed by the Conference on the Future of Europe. As you know, we all know the geopolitical situation. We know how it's a challenging situation, how strong now is our global actors as China or United States. In this slide, you can see how China increased their foreign investment, direct investment capacities in European energy sector, or you can see how EU depends on global production of key products and materials. You can see, especially in solar grade silicon or in carbon fiber composites and other things. We all know that European Union now is in very crossroads, because we are losing our power as global actor. As OECD presented figures, EU is going less and less effective and less powerful at global level. And in this fight, you can see how trade is affecting us. And you know that we are importing more than exporting, and it is very challenging for European Union. And of course, exporting we mainly more agricultural products and others, but less our new technological products. And of course, new European Commission reacted immediately, addressing all those challenges and proposing 6 political priorities. As you know very well, European Green Deal, the economy that works for people, Europe fit for the digital age, promoting our European way of life, a strong Europe in the world, and new push for European democracy. Of course, it was in 2019. And of course, you know very well that European Green Deal required a lot of efforts to understand situation, because it is multi-level governments, multifactorial issue, multidimensional issue, and very challenging goal to EU to be effective implementing such digital transition and European Green Deal. And in this slide, you can see thoughts about it. EU need to be a global leader in fighting climate change. Their ambitions to increase our targets from 2030 to 2050, to see supplying clean, affordable, secure energy, mobilizing industry for clean and circular economy, building and renovating in an energy and resource effective way, zero pollution ambitions, preserving and restoring ecosystems, and from farm to fork, fair, healthy, and environmentally friendly food system, and so on and so on. And of course, it requires a lot of efforts. And in this picture, you can see ideal picture. What can we think about our, everyday life? How can we achieve those goals? Clean air, cleaner energy, usable and recyclable packaging, and so on. And of course, we know very well that proposed Green Deal is based on 4 big pillars: environmental pillar, climate pillar, financing pillar, economic pillar. Of course, it is about sustainable Europe, and you can see all those those goals in those pillars. And of course, also European Union, Europe fit for digital age, because today you all are very keen on digital issues. And in this digital situation, we can see that, of course, such Europe fit for digital age is based mainly on internal market capacities. And you see 4 pillars here: digital, as artificial intelligence, digital service act, data standards, speaking about people, digital education, and so on, level playing field, digital taxation, and others, and of course industry. But let us go into industrial circle, because industrial circle is Europe proposed to have their industrial strategy, their so-called industrial capacities and autonomy. And European Green Deal is very interconnected with new industrial strategy, and you see that there are 2 sides of the same coin. Building a joint master plan. It means that industrial policy requires a lot of efforts from all positions, from sustainable finance, from EU budget, from trade, carbon pricing, state aid, connecting Europe facility, single market, and so on. And of course, developing, as you see, climate neutral technologies, and so on and so on. This technological neutrality, while technological neutrality remains a valid criterion, waiting for spontaneous market uptake is very likely to take longer than science tells us. We have to achieve a climate neutral economy. Choices must be made soon on the top technology priorities and value chain, focusing on clean tech and climate intensive industries. And of course, we all know very well that a whole of government approach at the heart of the new Commission of working methods, based on a strong project team and co-creation at all levels of decision making. And here you can see how it is important to understand multidimensional issue when we are speaking about digital Europe, or when we're speaking about European Health Union or other compositions. And let's go into next stage. Of course, we all know that long-term budget is needed, and European Union agreed in 2020 to have till 2027 to have some figures. You know very well how it looks, and key figures in this agreement were that long-term budget for 2021 till 2027 is of 1,074 trillions, combined with the temporary recovery instruments Next Generation EU, about 750 billion euros. More than 50% of the amount will support modernization through policies that include research and innovation via Horizon Europe, fair climate and digital transition via the Just Transition Fund and the Digital Europe program, and so on. And of course, Next Generation EU. This is the first time in European history as we see as the European Union started to think about new European Union so-called debt. It means recovery and resilience facility. But we all know that all our ambitions should be covered by money. And sometimes we do have very strange understandings. This EU budget is very big. Now, if we compare EU budget with all, here you see EU 28 gross national income, but the same speaking about it, EU 27, that EU own budget is very small. And if we should be more ambitious, we need to think about how we can, improve our financial capacities and to have a little bit bigger budget. And of course, as you know, European Union proposed the digital decades targets, and I'm very happy that a lot of companies, including like Vodafone or Microsoft or others, started to analyze situation. What does it mean? What's its context, scope, and purpose of those digital targets? And I can show you here only slides as examples, and of course, pricing those industries because they are doing very good strategic things, thinking about possibilities to fruitfully cooperate with EU. What it is very important to understand, the problems where is that the digital decade targets are ambitious and will require member states to make significant progress across each target. But the gap between current and targeted levels of digitalization is very, very much across all member states. And of course, further private and public investment may be needed in certain areas to achieve those targets. The Recovery and Resilience Facility instrument, which is proposed, is of course provided some opportunities, but summarizing the progress of digital investments that are being made by member states from RF, we can see that we need to think in much more effective way to cooperate. And of course, key findings were that EU digital vision presents ambitious goals, but doesn't matter that coordination across governments to ensure digital investments should be strengthened, it should be targeted, synchronized, and so on. And connecting digital ecosystems is also very challenging issue which should be addressed with all together. And in this vision, digital plays a so important role in every area, in e-health, in smart agriculture, smart grids, smart construction, in e-government, smart manufacturing, connecting infrastructure, smart cities. All those areas can really change situation and help European Union to be much stronger globally. And of course, economic benefits are clear, productivity gains in innovation that drives economic growth. And of course, environmental benefits, social benefits, I just mentioned a few. But achieving the EU vision for a digital future, we need what? We need to coordinated actions across governments, and not only across governments. We need also to understand that it is very important to see, is the European Union institutions ready to act in more effective way? And of course, I am not ready to go into key enablers because you can show, and here you can see some efforts to assess situation in healthcare, building reports which can show how can we act in a holistic way, how we increase access to treatment, how we can better serve communities, and so on. And of course, some are thinking about cloud of healthcare, which can enable to have better experience, better insights, better care. And you see personalized care, the patient insights, virtual health, clinical analytics, operational analytics, data interoperability, continuous patient monitoring, care coordination, care team collaboration. All those issues should be, improved, should be empowered, and of course, enhance patients' engagement in this situation. And you can also see some industries now just started to develop telemedicine programs, platforms, and it can create very new opportunities. But and of course, speaking about scare systems, digitalization can really open a lot of possibilities to local authorities, to governments, to create connected hospitals and ensure possibilities to address challenges like healthcare workforce shortages and so on and so on. But let me tell you a little bit different issue. Here you can see map of of discontent in the EU and see how people are voting in favor or against thinking about possibilities of more integrated Europe. And recent elections in the Netherlands were absolute examples. It was no surprise that today the first political party, which is frankly speaking very Eurosceptic against more integrated European Union, but in 2018, it was known that something will happen with European Union, with fragmentation, and European Commission at that time proposed 5 scenarios. How can we act in the future? But in those scenarios, health and digital transition both doesn't mention. But when virus struck, COVID struck all of us, public opinion about health changed dramatically. And in now you can see that a lot of people are thinking that EU must do more in health. And health is always on top in public opinions, as you see in this slide. In 2020, only few dreamers dared to call for a stronger representation of health in European treaties. And of course, in September 2020, European Commission President Ursula von der Leyen proposed to build European Health Union. And she mentioned, for me, it's crystal clear. We need to build a stronger European Health Union. And then, of course, Manifesto for European Health Union was developed. You can see and can find such manifesto on the web. And after Conference on the Future of Europe started, and Conference on the Future of Europe also proposed a lot of issues, keeping in mind health and digital transformation. And you can find excellent, document. General Secretariat of the Council presented, outcomes of the conference, and you can see a lot of proposals which are, speaking about digitalization in health, or creating digital Europe, or enforcing healthcare systems and so on. But I just speaking about data protection. And in summary, at the conference, it was very important to see how it was presented 4 cross-cutting topics, just give clear and strong mandate for the European future. And first, a European Union based on solidarity, social justice, and equality. Indeed, a great concern for the citizens is to find equal conditions and rights in different areas: healthcare, social services, educational, and so on, and including digital issues. Of course, EU needs to be bold and act fast to become an environment and climate leader by making the transition to green energy faster, improving its railway networks, encouraging sustainable transport, circular economy. EU needs to lead in many areas: in agriculture, biodiversity, transport, digital transformation, and climate diplomacy, and so on and so on. And of course, after the conference, the future of Europe, European Parliament presented positions about, the future. And as you know, they stressed in European Parliament that that conference on the future of Europe finished its work and presented its conclusions, whereas those conclusions contain 49 proposals and 326 measures, but many of which are only possible to implement if there are changes to the treaties. And European Parliament just a few weeks ago voted in favor adopting resolution and calling Council to convene new conventions and to change treaties. Why we are speaking about treaties? When we are speaking about health, European treaties are very weak on health. Health is not on the preamble of the European of the Treaty of European Union. The aim and all main objectives of the EU are enforced by Article 3, but health is not part of the Article 3, and digital also. Development of health is considered necessary to the Union insofar as it serves better functioning of the internal market, Current health union related initiatives are not talking about health as a specific objective of the EU, as an aim. The talk is about a well-functioning internal market. And you can find numbers, how many times ministers of agriculture gathering in Brussels, or ministers of ECOFIN, and how many times gathering ministers of health. It is clearly, but I can tell you a little bit later. European treaties see health as an ancillary issue. The EU has a power that is funding member states to allocate to it, and no more. We do not blame commissions, but we know that legal limits which are enshrined in treaty are very weak. The EU can only support, coordinate, and supplement member states in health if member states express a willingness in public health domain. Health care and cure is sovereign competence of member states. It is not longer good enough. And Europe needs more shared competences and more cooperation in health. And you can find a lot of examples of what it is absolutely clear that it's unthinkable to fight against pandemic within national borders. It is impossible to fight against cancer also not having enhanced pan-European solution. European health science and health industry has no chance to compete with the United States and China without proper support of fundamental research and opportunities to count on a region with 450 million population. And we just presented our study, which was read by 14 experts, European Health Union, a blueprint for generation. And in this study, we call very clearly what we need. We need Europe. If Europe will deliver on the promise to develop a genuine European health union, we will see more saved lives, more solidarity, higher level of competitiveness of Europe. But of course, these results will not come without our efforts to improve our treaties. Strengthen the role of health policy in the Euro Treaty is absolutely needed. For safeguarding the European solidarity, the European Treaty should be upgraded by including public health into a domain of shared competences. Of course, the challenge is not to make the EU responsible for all matters in health. That would be a great mistake. We need the EU to share some responsibilities in public health and the areas of rare cancers, rare diseases, while preserving subsidiarity as a core principle. As we know very well, that the EU is triangle: European Commission, the Council, and Parliament. And Commission is guardian of the treaties, and it developed so-called community-based capacities. Council is built on intergovernmental rules, and European Parliament is our democratic institution, which is capable to guarantee democratic legitimacy. And European Health Union is not about limiting, but about strengthening powers of all of member states through more effective cooperation at intergovernmental level, of European Commission through more effective coordination and integration and possibilities to act in more fastest way, keeping in mind shared competences, and European Parliament through more effective representation of people concerned in public health, and of course national parliaments through more effective control of principles of subsidiarity and proportionality and possibility to be involved in all issues. Pan-European cooperation can create added value in pan-European goods in health. Most actions in health require involvement of governments at national level. The EU should take decisions and action when the objective of an action cannot be sufficient achieved by the member states, but can be better achieved at EU level by reasons of the scale and effects of the proposed actions to have. Shared competences between EU and member states are providing an opportunity to enhance the health of Europeans by targeting policies member states are failing to perform alone. And of course, health is a multidimensional issue with different actors best suited to play different roles. And pan-European cooperation based on shared competencies has its role. And you can find a lot of examples why we need to have such competencies. Health should appear on the preamble of the Treaty on the EU in parallel to internal market and economic and monetary union, and so on and so on. We need to amend Article 3. We need to change, to extend Article 168 of Treaty on the Functioning of EU. Why? Because we need to have shared competences between EU and member states establishing European Health Union. And next very important publications is EU treaties, why they need targeted change. And here I will draw attention on very important issues related to digital issues. This report shows that that we will focus on the key challenges ahead in making the case of new European public goods, developing the means to deliver these European public goods, and of course analyzing how can we can achieve treaty changes. This report presented 5 major reasons to identify and justify targeted treaty changes: more security and strategic autonomy regarding peace, energy, food, critical materials, and digital transformation, stronger European drive to conduct the greener transition and the digital transformation while tackling new social inequalities, a larger scale investment capacities at the EU and national levels backed by sources of taxation, a more attractive EU democracy in its representative and participatory components based on European citizenship, and enlargement as a new geopolitical imperative. And we can. I can't go into details because time is running very fast. I have only 10 minutes, and such study after study shows that citizens of the EU want a Europe that does more than just produce rules. They want a Europe that is capable of taking actions not just on security and defense, but also on sustainable development, digital transformation, the fight against pandemic, and more generally, health and solidarity. All subjects that today go beyond the borders of the European Union. These are all issues that today go well beyond the national framework and call for massive European action that is not limited to regulation, but requires a capacity for implementation on the part of the European Union that is not currently part of the DNA of the European Lisbon Treaty European project. This enforcement capacities is not provided by the treaty, but if we can go into next stage, we need to accelerate our efforts. The current technological revolution that will shape the coming century is based on both the platformization of EU economies and the rise of artificial intelligence. In both cases, the advantage goes to powers with a vast standardized domestic market, a powerful army and defense industry, and a powerful continental investment capacity. Today, democratic sovereignty and strategic autonomy of the EU depend essentially on the ability to have its own sovereign infrastructure, which in particular determines the ability to protect the data of our fellow citizens and our businesses. As you know, China and India and United States are in a much better situation than the EU. And of course, we need to think about possibilities, how we move quicker. And, when we are speaking about ecological transition, about digital transition is which require not only swift regulation of the European markets according to European values, but also determined actions to develop European capacities in many new ways, from broadband and skills to semiconductors, computing, cloud services, search engines, and artificial intelligence. It is important to underline that current Lisbon Treaty does not reflect the digital age, colleagues. and that there is not a single reference, even to the word digital. The digital dimension must therefore urgently be mainstreamed and enshrined in a new chapter of the European Union Treaty. And you can see that when we are speaking about proposals, what we can do, how can we propose shared competences. In public health, shared competences with a reservation of national competence for definition of their health policy. In digital policies, we need to also have new shared competences, including among the objectives advancing European strategic autonomy and so on. And how to leverage digital transformation to build up new European public goods in digital age. Of course, sustainable and social issues are henceforth at the center of all European policies. Digital transformation is both a transversal challenge concerning nearly all European policies, but contrary to the two previous topics, speaking about monetary union, internal market, there is no legal basis in the Lisbon Treaty and the provisions treaty concerning the digital transformation. Digital was consequently ignored. There is consequently a need to update the treaties. Up to now, the European institutions have mainly focused their efforts in regulating the digital sphere rather than reflecting on how to leverage the potentialities offered by the digital technologies to provide public goods. The legal basis was limited. It was mainly the part of the treaty related to the internal market. And we need to understand that digital transformation concerns all the activities of our societies, which can be transformed in depth by the digital evolution. There is a need of a critical mass of data and size to fully leverage the potential of digital technologies and artificial intelligence more specifically. Their implementations can be significantly different according to the civilization priorities. For instance, China prioritizes the digital transformation to develop a society of surveillance. United States favors the maximization of economic value and extraterritorial influence. The EU and its member states tend to prioritize the human-centric dimension. In other words, to which extent the potential of digital can serve European societies, European values, and more generally the dignity of the body, its freedom, and the idea of equality. These different considerations plead to develop a new chapter in an updated European treaty. Digital should be recognized as a shared competence between EU and the member states, due to the fact that it concerns potentially all dimensions of the social, political, economic, ecological, and other lives. The possibility of passerelle clauses need to be considered for digital. Besides, the external dimensions of digital policies poses also the question of qualified majority for the external policy of the European Union as far as the digital dimension is concerned. And of course, we know very well that we have a lot of toolbooks. How can we implement such digital transformation? The toolbooks are very rich. It includes general principles such as artificial intelligence, ethical principles, regulatory instruments, regulation, directive recommendations, funding instruments, Digital Europe, structural funds, R&D funds, Horizon, and so on. Provisions of services of public interest concerning different topics, such as digital passport in the health field, support to digital skills in the educational field, support to digital production in the cultural, the media field, industrial strategies. These toolbooks could be reinforced with the possibility to develop joint procurement for digital services, at least for EU and member state administrations, but also for organizations, be it public or private, with public service missions such as public service media, health organizations, and so on. This is particularly important for high-quality content distribution infrastructure, cybersecurity infrastructure and services, digital health services in the field of diagnostics or human virtual twin, digital multilingual democratic instruments, and so on. Of course, time is now to rethink our capacities, how we can improve EU being global leader, how we can improve our Lisbon Treaty, how we can include digital and health issues into Lisbon Treaty as an aims and as a tools which can allow us to have some shared competences. It's time to include a new pillar, digital health and well-being union. And I call all of you, my fellow European citizens, let act, let unite, because it is good time to see how to encourage our member states governments, national parliaments to convene new convention and to improve our treaty, inserting health and digital unions into treaties as a shared competencies. Thank you very much indeed.